Hello and welcome to the Relax It's Retirement podcast with your host, Josh Leonard, where we talk about transitioning into retirement with intent. I'm Wendy McConnell. And of course, we have Pete Belcastro here today because he's a recurring character here on the podcast. Because I like to call you a recurring character because you're a character.
That's one of the
I
better
think
things I've been called.
I think we've had this banter enough. I wonder if we need to edit that intro a little bit to just, maybe put Pete in there. We'll see, Wendy. We'll talk offline. We'll see if he's worthy of it.
Yeah, we'll have to make that decision independent of Pete Belcastro.
I'm sure.
That's right. We
Yes.
can't talk about him with him present,
So today we're going to be talking about something very exciting, healthcare.
Yeah, everyone's always thrilled about healthcare. Healthcare is one of those things that I think is frustrating for many of us, right? The cost of healthcare in the U.S. seems to be endless. I always joke that, like, in your working years, you get a health plan, and if you're fortunate enough to have benefits through work, you pay for that, and then you pay every single time you go to the doctor, too. So, like, you just pay. I don't know what I paid for the insurance for, because then when I need it, I still have to pay more. Like, it seems to be endless. But transitioning into retirement, we have some options there, so it's a good time to reevaluate. And I hate to break it to you, Wendy, but as you get older, you probably need health insurance a little bit more, or you're using the healthcare system a little bit more.
Yeah, I mean, but that's why we prepare for this kind of stuff, right?
I think so.
That's it. I think that one of those stats are, usually, the last 20% of our life, we spend about 80% of our healthcare costs. So it's something that, unfortunately, the older we get, the more things that could go wrong, let's just say.
Well, and I'll have a little bit of a funny story. With my husband, they have like a meeting every month. They're always changing things about the healthcare plan, and it goes up in premium every year, the amount that we have to pay. And he brought this up in one of the meetings, and the woman that was conducting the meeting said, "Well, everybody keeps using it."
Yeah. So,
I mean, the nerve.
as an employer, yes, we joke that, you want to have really good health benefits, but if you have to use them, then the whole group gets more expensive. So it's like a catch-22.
Right. Yeah. So I just thought that was pretty funny. I'm like, well, I thought that's what it was there for, and that's what we pay for.
But, it's like your car insurance, too. You don't just crash your car once a year to make sure that the insurance still works, right? So...
Oh, I don't think talking about going to the doctor is the same as having a car accident.
But, no, if you have major surgery or something, it's incurring the insurer money, much as you crashing a car is the way that they're looking at it. But you're right.
Yeah.
I think, and one of the things we'll talk about today is, it's good to go to the doctor and get things checked out, too, and not just ignore it.
Absolutely. So, but today we're going to be talking primarily about Medicare, right?
Yeah, we're going to talk about that retirement chapter. So, I think first off, understanding Medicare is probably the biggest one. We work and we have all these, co-pays, 80-20, 60-40 plans, and we've digested that. And then as the plan changes every year, we've adapted to that. Well, once we retire and go on to Medicare, we're now under a new system. And luckily, they've assigned letters to everything, so we can get even more confused. So, starting off, the first original Medicare is Part A. And Pete, I'm going to test your knowledge here. What does Part A cover?
This is your hospital coverage, right? So this is, thank you, Josh. Yes, I need tested once in a while. Absolutely.
Even I knew that, though. I mean, come on.
That's right. So we're talking about, the hospital care. Also, Part A covers that skilled nursing, even end of life type of hospice care, and some, like home health care. So those basic coverage is Part A.
Now,
Yep.
is that the one is that the portion that is cost free?
You got, yes.
Well, cost-free has a million
You've already paid
asterisks
for it.
in healthcare.
That's right. Yes,
Yes, you're
typically
not.
you don't pay a premium. Yeah.
That's right. You're not paying a premium. You're not paying a monthly premium. Part B, which is your doctor and specialist, is the easy way to think about it. There, you're paying a deductible, as well as your monthly payments. Once you're on Social Security, those are subtracted from your Social Security benefits. If you're not on Social Security yet, guess what? You still have to pay them, Wendy.
Yep.
Okay.
And I think this part B, as well as part D, is something that we talk to clients a lot about, because depending on your income for 2 years prior, it'll dictate how much you actually pay in part B and part D. Part D baseline is free, but then you pay more as your income goes up. So baseline for part D is $174.70 per month for the year 2024. Each year this goes up. In 2024 versus 2023, it's a $9.80 increase. So
And what is
you're
part
paying
D
more.
for?
That's
Part
that's your prescription drugs. That's
that is the most logical one. Part A is hospital, because hospital. Oh no, it doesn't start with an A.
it,
B is for doctor.
Right.
Yeah, that doesn't start right. D is for drugs. I get that. That's easy, right?
there you go. Yep.
D is for drugs, and then part C is an advantage plan that can kind of wrap A, B, and D together. So that also doesn't really make sense. But I didn't create the system; we're just sharing it. And like many
Yeah.
things, it's evolved over time, right? So part A was the initial. It was, hey, we're gonna try to make a system to care for the elderly folks in our society by having some hospital coverage. That expanded to B, and it's evolved over time. Um, you know, an advantage plan, like in the Pittsburgh market, they're heavily advertised for UPMC for life. For those of you in Pittsburgh, I'm sure you've seen advertisements, billboards, radio commercials, TV commercials. It's all over the place. And the idea is it makes it like your traditional healthcare plan that you're used to, where it rolls it all in. You have doctors that are in network and out of network and all that kind of stuff. Traditional A and B doesn't have that in and out of network. It's basically an 80-20 plan. So 80% is covered by Medicare, 20% you got to pay. That's the high level view.
Right.
Then drugs are a whole different piece, right? Because somehow that's a separate part of our healthcare system. Part D, I think one of the biggest things that we'll hear when we're helping clients prepare is, well, I'm not taking any drugs, so why do I need a drug plan, right? Like, I'm healthy now. Well, the problem with that is if you don't have credible drug coverage, whether through an employer or once you retire through Part D, then you pay a penalty for every month you didn't do it. So
right.
you're darned if you do, darned if you don't.
Wait, you're penalized for not enrolling in the plan?
For not having a plan, that is correct. Yes.
So then why would you not have a plan?
Well, you have to have a plan. But for many folks, they think, oh, I'm not taking any drugs, so why would I pay for a plan, right? That's a logical thought.
There's a lot of things that we typically see that people have overlooked whenever they're looking at the Medicare, which is why it makes sense to kind of dig into these things because, like Josh mentioned before, there's income things that affect your coverage. It's not right now. It's not like, all right, all of a sudden I took a more income and I see that reflected. It's going to be 2 years in the future. So, gosh, a lot happened just yesterday, let alone last year or 2 years, right, Wendy? I'm sure in your life too. So, whenever we start talking about these things, if you aren't aware of a lot of these factors, you can really get caught, and there's nothing you can do because you did it a couple years ago. You did it a little bit ago. So like Josh mentioned, if you don't sign up for these things, you're not aware that you had to, even though right now, like you said, maybe I don't need this drug coverage, or I've looked at, maybe we'll dig in that a little bit further, but I looked at, and I can get a generic version, outside of, outside of the U.S. even, that is outside of my coverage. So why would I even need that coverage? So, that's kind of just why why we need to look at these things and be aware of those type of rules.
Yeah, because they make it so easy to understand. So let's
That's right.
move on.
Yeah, I mean, I think part D for your drugs are going to change over time, right? The drugs you took in college, or oh no, I mean your drugs that you're taking when you first retire. Um,
Josh, you are such a bad
okay,
boy.
guys. Um,
Okay.
but your prescription drugs that you're taking at the beginning of retirement, maybe you are pretty healthy, but maybe you take something for high blood pressure or cholesterol, something that is pretty common. But later on in retirement, well, maybe you got a list of things that you're taking. Each and every year, you can reevaluate that drug list and shop for a plan that might help better or cover that cost. So, you know, that kind of goes into our supplemental insurance, right? So we need to talk about how we're going to supplement our cost of insurance overall. Medigap or supplements are the baseline plan. So if we're not doing that Advantage plan, we can take Part A and B and add on a Medigap or a supplemental insurance plan. Now, here's what makes this really confusing. Those are also lettered plans. So we got a B, and C plan there, totally unrelated to Medicare Part A, B, and C. But, don't worry, we'll throw a D in there too that has nothing to do with drugs. We'll link in the show notes to the Medicare website that goes through a nice chart that covers all those plans. When we're working with a client, we typically look for affordability versus coverage. A Plan G is one of the most robust plans. It covers almost everything for you. And by doing that, your healthcare costs become a lot more predictable. Now, if that's unaffordable because the monthly premium's too high, it doesn't fit in your income plan for your retirement, we might look at a different level plan. Or maybe you don't travel out of state ever, or maybe you don't plan to travel, so an in-network doctor might make sense. We might want to go with an Advantage plan. That might be cheaper for you. But we need to evaluate that prior to retirement, because we have a magical thing that happens when we first go on Medicare. They don't care how healthy you are. If you try to switch from an Advantage plan to a Medigap plan later on in retirement, they're going to evaluate you based on your current health. So we want appropriate coverage at the beginning of retirement, not wait until we get sick or wait until we get in the car accident and then try to get coverage, right? We need it ahead of time.
Hence, insurance.
That's exactly it. Yeah.
You got it. And that's, so there's some flexibility with this thing, it'd kind of be a little easier if it was black and white and you retire or you get to age 65 and boom, here's your options. But no, there's a lot of options out there, and like it or not, it can be tailored to yourself. So
yep.
It takes a little bit of forethought, but still I think it's better than everybody kind of being pigeonholed into one area and then you missing something that would really apply to yourself.
So, all of this insurance, all these different plans means that when I have to go to an elder living facility or when I need to go into maybe some sort of, nursing home, or we don't like that word, but, it's all going to be covered, right?
Nope. We got to pay more. So in your beginning days, before you go into the nursing home, a lot of that's covered under your basic cares. But when we think of that long-term care cost or that nursing home where you're in the elderly home for a long period of time, that's a separate thing, and a separate thing that we then have to evaluate. And one of the things we talk about is, how do I pay for the nursing home? So Wendy, what's the answer? How are you going to pay for the nursing home?
No, you're the expert.
Oh, that's right. Yeah. Every year, Genworth does an annual survey, and in 2023, the cost of a semi-private skilled nursing facility room, the annual cost is $104,000. So if you have an extra $104,000 laying around, you're all set. You don't need to worry about the cost. If you want that private room, it's going to be a little bit more, $116,800 per year. So, for most folks, that is not something we can just blend into the budget. Right, Pete?
That's right. It's hard to come up with that, especially whenever you are retired and you are in a fixed, fixed income. So, that those numbers are pretty staggering. I think the one thing is though, obviously, for that type of care, good or bad, usually people aren't on it for that extended period of time.
We always need to plan for the worst case scenario, but you're right. Many folks within the first 30 days of being in a facility have passed away. So that $116,800 a year doesn't come into play if it's only for a month, right? And one of the solutions that the industry had was long-term care insurance, right? And I think one of the problems we experienced this with my grandmother is you buy it when you're younger and you keep paying that premium. Well, as your age cohort gets older, well, more of them go on that care. And well, what happens to insurance when more people are using it? Just like we talked about with your husband's health insurance, Wendy, the cost goes up. So as you're getting older and
Yeah.
later in retirement, the insurance you're probably going to need soon is becoming cost prohibitive. Well, that's not a good plan for us. We don't want that. We want to make sure we don't run out of money in retirement and we're comfortable. So traditional long-term care, although it's guaranteed renewable, that they'll keep renewing the coverage, that cost can be unaffordable to many folks. So what we've seen and what we've helped a lot of clients evaluate is those old policies. Hey, can we reduce the insurance coverage to make it more affordable? And then how can we blend that in with your plan? I think talking through your options, one of the bigger options that people are taking on now is just self-insuring. Like, I'm going to have to spend down some assets to cover my care in retirement. That is one option. You can also use things like life insurance, where you can have a defined amount of coverage there, and then the cost is very predictable. But in your retirement plan, you should address these concerns and see what options might fit you best.
That's right. There's a lot of factors to consider. Every long-term care, most policies have elimination periods as well that you need to be aware of. So
Mm-hmm.
that's pretty much how long you need to qualify for the care. It could be 2 months. You could need to qualify for this care for 2 months before you could, before you could actually get that. So lots of factors to consider, especially like Josh said, whenever you start getting older, these costs start to increase. That maybe it makes sense to try and self-insure. But definitely, definitely something you need to plan for. Like we talked about previous, videos, that once you get to that point, it's too late to plan for that. It's too late to be prepared.
It's almost like you pay all this money, and then when it's time to use it, they're like, "Sorry, we're going to raise you even more so that you can't afford it anymore." There's something wrong with this whole system, guys. Really, something wrong.
I,
I
I,
see
I
that.
agree. I agree. As a financial advisor, though, our job is not to write legislation. We'll leave that to those other people. Whether or not they do a good job is a very separate conversation. But we want to help you navigate that. So, hey, these are the rules that we have to play by. What's the best way to navigate it? I think, as you alluded to, the problem is people are maybe sold this long-term care insurance thinking, oh, I'm covered for later on. And then as those premiums go up, they're not covered. They're not able to be covered. This is also true with your drug plan. So we had mentioned a little bit previously about checking in on your Part D or your prescription drug plan annually. We need to shop that out each and every year in retirement. Even if your drug list hasn't changed, there might be a better plan that can save you money. For my parents, we did that last year. Their monthly premium went from about $10 down to 50 cents. I'll pay a 50-cent premium for any sort of coverage. That's fine, even if I don't use it. 50 cents is cheaper. Well, for some of the medications they were taking, the medications were actually cheaper through the lower cost plan as well. So it makes sense to take a look at this each and every year. This is a great way we can control our costs of our drugs, which as we get older can be a very, very substantial part of our healthcare expenses.
Yeah, those things are always changing. There's always something new being developed, something that's been around for a while that now has a generic option.
Mm-hmm.
People, kind of doing the Costco or Sam's Club thing, where maybe you can buy in bulk, something you're going to need for a while, or even some options that are maybe just north of the border. So there's some ways to try and rate in those costs for your prescription drugs.
Yeah, our
So
Part D plan is one piece of it. I think also looking shopping out through other things, like there's like good RX cards or different pharmacy cards that you can get. Sometimes drugs are even cheaper through those avenues. We've had a few instances where through an employer's prescription plan, the cost of drugs was lower for a client than once they were going to go on to Medicare. So in doing that planning, they thought, hey, can I see if maybe I can get a 3-month supply or a 6-month supply, depending on what's allowed with those individual drugs. But maybe we buy those ahead a little bit, or maybe if it's like a ointment or something that you only use occasionally, well, great, let's stock up on that before we switch over to the new plan. So just thinking ahead there and knowing what your costs are going to be after that transition can help you save some money there. But we're going to have some healthcare costs.
That's right.
So let's use the most magical healthcare account, the HSA, to hopefully save us some money, right? So I know I've talked about it. It is It's so magical. Like, it is super because you don't pay taxes when you put the money in. You don't pay taxes when you take the money out, as long as it's used for healthcare. And you don't pay taxes on the growth in the meantime. So if you're still working and you're thinking about preparing for retirement, great. Let's stock as much money as we can into an HSA if you're eligible for it. So you have to have a high deductible insurance plan in order to be eligible for that. But for an individual, this year you can put $4,150 into the HSA. If you're a little bit older, so 55 plus, that retirement's coming really soon, you can tack on another $1,000 onto that.
Is this something that you have to go through your employer, or can you open up your own account like on your own?
Good question. So unlike a 401k, an employer will offer a plan, but you don't have to keep it with the employer. So if you have an HSA through your employer, make sure that you're taking full advantage of it. A lot of employers will offer a match on the HSA to a certain amount, or if you do certain wellness activities, they'll give you maybe a $500 or $1,000 credit in your HSA as well. So make sure you're aware of those benefits, but you're able to roll that over into a self-managed HSA with someone like Fidelity, or you can shop online to find a lower cost provider. They can't hold that captive. You're allowed to roll that over at any time.
But it has to be through your employer where it starts. Is that what you're saying?
No, you can set up a plan individually, but most of the time there is some incentive for using the employer plan, whether it's a match or, for a wellness activity, they give you some kind of credit there as well. But you don't have to do it.
I don't have this option. I have the other option where I have, I can't even carry the money over. It gets so I mean,
you have a flexible spending account. Yeah.
Yeah. So in that situation, I mean, I have what I have, right?
That's true. Yeah. Do you have a high deductible plan though?
We did, but I don't think that we do anymore because again, people kept using it, so they had to make changes.
So the key is having that high deductible plan. But let's say you're self-employed and you buy your own health insurance, you can set that up wherever you want. It doesn't have to be through an employer.
Okay. Thank you for explaining. I've been wondering that for 2 years now. So thank you.
Oh, okay. Yeah. HSAs are amazing accounts. So, I would say once you do retire, we have the tax advantage. We can contribute that money. I don't think we talked about family coverage, so I'm going to jump back. $8,300 is how much you can put in if you have family coverage. So if you're working at the employer that has the better coverage and your whole family's on it, you could put up to $8,300. That 55 plus, that later on contribution would apply to. So if you're over 55 and you have family coverage, that's $9,300 you could stock away there. Tax advantages are big. We can use it to help pay for those Medigap or those supplement plans in retirement as well. So that's a big plus. The monthly ongoing premiums can be paid with the HSA funds. We could use it for those long-term care costs as well. So if we're planning far enough ahead, we could maximize our contributions invest them so that it grows, and maybe 20 years into retirement or 15 years into retirement, when we actually need the money, it's grown to a sizable sum to help cover that $116,000 cost or whatever it might be at that time. So I don't know. Pete, do you think the HSA is magical?
Those are one of those, healthcare costs. That's one of those things that we know will continue. They will go up, and you will have that in the future. So putting money away for that is, it's a guarantee as much as, retirement, having to kick off the work boots at some point. So, you put it away for yourself. Like you said, you put away, $1 here. When you go to need it, maybe it's $5 or $10, in the future. That's pretty magical. Yep.
I think so. You know what? I have the best solution for healthcare costs, though. Just be healthy.
Stay healthy. There you go.
You got it? You got it, guys? Okay, good. Podcast summed up.
Never get sick. Yeah.
We do want to take preventative care, though, in all seriousness. Of course, we want to eat healthy, exercise, we all know these things. Now, whether we do them or not is a different thing, right? But by doing that preventative care, we can help hedge some of those costs in the long term. Being healthy, exercising can also just make us mentally happier too. I'll take that any day, right?
Absolutely.
So sometimes
I know I was going to say, I know that, we had some knee surgeries go on. Both Josh and my dad had knee surgery. My father was a little bit overweight, and just to get prepared for that knee surgery, now he's off of his, I think it's cholesterol and his high blood pressure medicine, just because he had to lose that weight. So, that preventative care type of stuff, it kind of compounds on itself. So pretty neat.
Yeah, I mean, my dad had both of his knees done, one in each year, and he's been working through it now for 2 years, and I think he was pretty miserable. And for myself, I'm like, well, either I'm going to exercise, and I'm probably going to need a knee replacement eventually, or I'm not going to exercise, and I'm going to need a knee replacement eventually. But what we've seen in working with clients is if you are healthier and exercising, even if you're prone to deterioration of your knees or something like that, if you're healthier, your muscles and your body can help heal quicker. So if you're healthy, even if you do incur that, your ongoing cost and ongoing pain and discomfort of it might be shorter by being a little bit healthier. Pete, as you stated with your dad too, now he's saving some money on those cholesterol drugs too, right?
You got it. It has those compounding effects. Quality of life is better. I mean, we always talk about, that we are retiring with intent, and it's hard to, have a fulfilling retirement if you just can't get up and move around. So, just adding that mobility and like we talked about, the cost, maybe you're on less medication. It really is the compounding effect is factors of 10. It's really good.
That's exactly it. You can't win a pickleball tournament in retirement if you're not healthy, right?
Oh, I know. You might not even be able to do it if you are healthy.
Health planning is a key piece of our retirement planning. We need to make sure we're thinking about these factors we talked about today. Of course, being healthy, understanding Medicare, shopping out our plans to make sure it covers what we need it to cover, and looking down the road to make sure we're not going to get hit with a gigantic health bill. That proper planning ahead of time can save us a lot of time, money, and frustration over the long term. So if you're looking to prepare for retirement, meet with your advisor. If you don't have an advisor, Pete or I would be happy to talk through that health plan with you. There'll be a link for a 15-minute phone call in the show notes. You can schedule that call with us. We'd be happy to talk through some of your health concerns, talk about maybe your plans at your current employer to make sure you're taking advantage of those now. If you're not already, make sure that you like, subscribe, and feel free to comment or let us know other show topics you'd like us to cover in the future.